Hi, Dr. Baumholtz, Baumholtz Plastic Surgery, and today I want to talk about discount plastic surgery or bargain plastic surgery. Very, very often we will give someone a quote for a procedure and they may say to us something along the lines, well, Dr. X will do it for a third of that or half of that or some variation on that theme. And that's okay. And we want patients to have happiness with what they're choosing, and that starts with the entire experience. In other words, people really have to believe that they're getting a good value proposition for the work that they're choosing to pay for. Aesthetic surgery comes at a cost, and we think people should feel good about what they're doing. That said, what I think we bring to the equation is decades of training, certification, experience, work, and comfort with the kind of things that we do. We talk to patients the way we want them to talk to us or our family. But let's talk about some things you might want to consider if you are in the mindset to price shop for plastic surgery. Okay, how do other surgeons do things at different price points than other surgeons? Okay, number one, where's my surgery going to happen? Is it going to happen in an office setting or is it going to happen in an operating room? Obviously, if you're going to an operating room, you're going to typically pay a higher price because the notion is that you're paying for more safety nets underneath you. That's not always the case. There are some very, very fine office-based operating rooms, but in general, you're paying for a higher level of safety when in a full-scale hospital versus a physician's operating room or office operating room. Okay, who's actually going to be doing the surgery? Is it the surgeon you met? Did you meet the surgeon? Did you meet a handler and not the surgeon? Hopefully in the modern era you're meeting surgeons before having surgery, but who's going to be there in the operating room? Does the surgeon have a first assistant? Is there someone else that will be there? Or is that person you met the one doing the surgery? These are good questions to ask. Who's going to do your anesthesia? Who's keeping you safe while you're asleep? Will it be a board-certified anesthesiologist or will it be a CRNA or something different? These are good questions to ask because these are ways that cost controls can be employed to give the illusion of a cheaper or bargain surgery. Okay, if it's an operation that involves implants, what implant is being used? Is it the newest generation of implants or is it an older generation of implants? Is it the implant you think it is? Is it the saline versus silicone? These are different ways that surgeons can lower their price, or make the price seem cheaper. Who will I see after my surgery? Am I going to see the doctor that did my initial intake and interview and the one that did my surgery? Or will I be passed off to office staff never to see the doctor again or rarely to see the doctor again? Here, with very few exceptions, I try to see everybody before, well, everybody gets seen before, and then I try to see them every visit afterwards. Sometimes that's not always possible. If I'm in the operating room and someone comes in, we will have a staff or team member see them, but if there's ever an issue, you're getting to see my bald head. Okay, finally, am I comfortable here? So you've come to see me or somebody else, you're sitting in somebody else's office and they're radically cheaper, or maybe you're out of state and you're just comparing one versus the other, which is great. The question you need to ask yourself is, am I comfortable here? Have I looked at the reviews? Am I comfortable with the staff? Am I treated nicely? What's my gestalt, meaning what's my gut feeling about being here? And if you feel good, that can very well be a right choice for you. Well, I hope that's helpful. And if you have more questions or you'd like to visit us here, come see me at Baumholtz Plastic Surgery. Have a great day.